Assalamualaikum warahmatullahi wabarakatuh. My name is Luqman Hakim bin Mohamad Wazir. My number matric is 1210487. In communication theory, I will explain about help belief model. The help belief model was developed in the early 1950s by social scientists at the US Public Health Service. In order to understand the failure of the people to adopt disease prevention strategies or screening tests for the early detection of disease. The help belief model suggests that an individual's perfection will predict a person's adoption of behavior. There are two components of health-related behavior. Number one, to avoid illness or to get well if already ill. Number two, belief on effectiveness of health actions. Ultimately, an individual's course of action often depends on the person's perception of the benefits and barriers related to the health behavior. There are 6 constructs of the health belief model. Number 1, perceived susceptibility. Number 2, perceived severity. Number 3, perceived benefits. Number 4, perceived barriers. Number 5, cue to actions. And lastly, number 6, self-efficacy. First is the perceived susceptibility. Perceived susceptibility refers to an individual's subjective perception of the risk acquiring an illness or disease. An example of this is when a person was exposed to other person with an illness, he or she might think that he or she is more vulnerable in getting that disease. Second, perceived severity. Perceived severity refers to an individual's feeling on the seriousness of contracting an illness. An example of this is how the fluctuations on number of cases of a certain illness may affect the general public's perception of its severity. Third, perceived benefits. Perceived benefits refers to an individual's perception of the effectiveness of various actions to reduce the rate of illness or cure an illness. An example of this is promotion and application of preventive measures in order to avoid being infected by a disease or illness. Number 4 is perceived barriers. Perceived barriers refers to an individual's feeling on obstacles in performing recommended health actions. An example of this is how factors such as inconvenience, cost, lifestyle changes, and other factors will affect a person's perception. Fifth, cue to action. Cue to action refers to stimulus needed to trigger an action on the obstacles to performing recommended health standards. An example of this is the triggering effect of a personal experiences of symptoms or, if not an illness, of a family member. And the sixth one is self-efficacy. Self-efficacy refers to the level of an individual's confidence in his or her ability to successfully perform a behavior. An example of this, when a person who has a healthy lifestyle feels confident about facing daily activities amidst prevalence of a certain illness. Okay, next. The question is, where is the use of the health belief model in our lives now? One of the examples is that youth believe they can get HIV or create pregnancies. This situation refers to constructs in perceived susceptibility. In addition, another example of a situation that relates to the health belief model is that youth believe that the recommended action of using condoms will protect them from getting HIV or creating a pregnancy. This situation refers to constructs with perceived benefits. Okay, this is advantages and disadvantages of health belief model. The first advantages is acknowledge and address cognitive model, which lays emphasis on the role of motivations and faith on the individual. Number 2, publicize a person's opinions into 4 kinds: perceived susceptibility, perceived severity, perceived benefits, and perceived barriers. And thirdly, this comprehensive methodology scrutinizes a person's beliefs, opinions, and views, particularly in respect to healthcare in a further holistic approach in contrast with other models. Okay, disadvantages. Number 1, the model does not incorporate the influence of social norms and peer influences on people's decisions regarding their health behaviors. Number 2, adopts that cues to action are extensively predominant in positive people to act, and that health actions are the key objective in the decision making calls. Okay, next, lack of clarification on accessibility and economic access to healthcare. For example, many people with serious health illness lack health insurance due to the pre-existing situations. Conclusion. The health belief model provides important concepts related to the behavior change necessary for the prevention and early detection of community health problems. It provides a means of understanding and predicting how a person will behave in relation to their health, as well as how individuals will comply with proposed healthcare therapies. Nurses work collaboratively with communities to build on their strength and facilitate empowerment. The health belief model guides nurses in understanding factors influencing perceptions, beliefs, and behaviors to plan care that will prove most effective in assisting clients in maintaining, restoring, and preventing illness. That's all from me. Thank you.